In this lecture, we will review the aims, benefits, phases, and potential risks of a cardiac rehabilitation program. The primary aim of cardiac rehabilitation is to enable the patient to regain full physical, psychological, and social status after a cardiac event. Cardiac rehab can optimize the long-term prognosis by secondary prevention. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. The following patient groups may benefit by cardiac rehab programs. 1. Following an acute cardiac event. 2. Awaiting or post-revascularization. 3. Stable angina. 4. Stable heart failure. 5. After valve surgery. 6. After heart transplantation. 7. After insertion of an implantable cardioverter, defibrillator or ICD. Myocardial oxygen consumption depends on the double product. Double product is equal to heart rate multiplied by systolic blood pressure. Double product determines the myocardial workload. Rise in heart rate and systolic blood pressure is determined by the oxygen consumption expressed as a percentage of maximum oxygen consumption rather than the absolute value of VO2. VO2 max increases with exercise training. Hence, the rise in heart rate and systolic blood pressure and consequently the myocardial oxygen consumption for a given level of activity decreases as exercise training program progresses. MET or metabolic equivalent is the basal metabolic oxygen consumption. 1 MET is equal to 3.5 ml oxygen per kg per minute. Cardiac output can increase almost 6 times with maximal exercise. Oxygen extraction from arterial blood can increase almost 3 times with peak exercise. Hence, oxygen consumption can increase about 18 times, that is known as VO2 max. But in case of coronary circulation, oxygen extraction is maximum even at rest, so that increase in oxygen supply can occur only by an increase in flow. A person with maximum exercise capacity of less than 2 METs will be in class 4. Those with an exercise capacity of 2 to 5 METs will be in class 3, and those with a capacity between 5 to 7 METs will be in functional class 2. If a person has more than 7 METs of exercise capacity, the functional class will be 1. Benefits from a cardiac rehab program will include a reduction in angina, blood pressure, anxiety and depression, as well as hospital admissions. There is an improvement in the lipid profile, functional capacity, better compliance with lifestyle modification, increase in the level of confidence, and earlier return to work and leisure activities. A comprehensive cardiac rehab program can include proper medications for secondary prevention and symptom limitation, graded exercise programs, advice on healthy eating, including participation in weight loss support groups, relaxation by stress management, general information on the disease process, and a training on cardiopulmonary resuscitation for the relatives. Exercise programs do carry risks of worsening of ischemia, left ventricular dysfunction, and potential for life-threatening arrhythmias. Hence, a proper risk stratification is needed prior to initiation of the exercise component of cardiac rehab. Exercise component of the cardiac rehab should be deferred in case of unstable angina, resting BP above 200 by 110, significant drop in BP during exercise, resting heart rate more than 100 beats per minute, uncontrolled arrhythmias, unstable heart failure, unstable or uncontrolled diabetes mellitus, and febrile illness. The program can be resumed after stabilization of these situations. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.